Welcome, 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 Be Health Empowered family, to another episode of Excuse Me, Doctor. I'm your host, Dr. Melissa Clarke. You can also call me Dr. Mel, and I am delighted to be back here with you this week for another episode. And you know, the whole reason we're here is to break down health topics for you and your family so that you can make informed decisions when it comes to your health. And we focus on the information, the evidence, the science behind it, so that you know that it's accurate and can be trusted. We don't, deal in a lot of speculation here. We bring focus to speculation. We clear up misinformation and we debunk disinformation. We're here every Monday, 9 p.m. Eastern, 6 p.m. Pacific on Facebook and YouTube. So thank you for tuning in. And I want to welcome my newbies. Please remember to hit like if you're on Facebook, and of course that red button subscribe if you're on YouTube. Tonight we have a really important topic that we're going to be talking about, and that is vaccinations for teenagers. We know that the Pfizer vaccine was recently approved for teenagers 12 to 15. It was already in use for 16-year-olds and above. And so I know a lot of parents, as we're rolling around to summer camps and, things are opening back up, that there are questions out there about the vaccine. And we have two really special guests tonight who are going to help us look into that. So share this episode right now. Take a minute, hit the share button, connect with the parents the grandparents the guardians, and the teens to let them know this is on. And I want you to definitely put your questions in the chat because we're going to try to get to each and every one of them. So I want to stop right here and, of course, bring in my wonderful co-producers who join me every week, Miss Lila Mays coming in from the West Coast and Mr. Wayne Bruce right here on the East Coast.
Howdy.
Hey.
Howdy. Oh, look at Lila Mays with the hat.
Thanks for joining me, y'all. I know, looking fly.
Hat game on point now.
Thank you.
Well, we're going to hit this weekly recap. And as always, we start with the numbers related to the COVID pandemic. We know that as of today, we are 33.8 million cases of COVID-19 and climbing. And unfortunately, over 603,000 deaths from COVID-19. But the good news is that both the cases and the souls that we're losing to COVID are decreasing every day. So the new numbers are getting less and less every day. And that is absolutely wonderful news.
It's great.
Yeah.
Great. That's great news.
Yeah.
Indeed. So, all right. Numbers, deaths, facts, Dr. Mel. What are we looking like?
Yeah. Well, we are looking pretty good. We're at 284 million doses given out, 125 million people fully vaccinated. And, we have these New England states, or actually northeastern states from New Jersey on up, plus Hawaii, have met the Biden goal of at least one vaccine given for 70% of more of their population. And they met it ahead of time because the goal was for July 4th weekend.
Okay.
But then we also have, so that's a good thing. But we also have those states that are lagging a little bit behind. Some of them are in the South. And what we do know is that those states that are sort of at the head of the class, leading the curve, that we're seeing a lot fewer cases of COVID-19 in those states than in the states where less than half of the population is vaccinated. Okay. It's like over a 20% difference. So it's significant. Right. And then the other thing that we worry about too is these vaccination rates aren't just varying by state, they're varying by county. So we know that 7 in 10 rural residents are not getting vaccinated. And we also know that young African Americans between the ages of 18 and 30 are also another group of people who have the lowest vaccination rates. So we worry about these unvaccinated pockets of people because they're going to be COVID reservoirs. They're going to be places where new variants can pop up, and that might even then spill over to be a problem for those who are vaccinated. So
wow.
definitely something that we need to be concerned about.
That deserves a Scooby-Doo.
That is. So in that vein, Dr. Mel, you just said these variants. One of the variants that we've been hearing more and more about is this Brazilian variant and the impact it's having on children. Can you address that?
Absolutely. Well, before we even get to the Brazilian variant, the India variant, the one that's been causing all the havoc in India, is also here now too.
Right.
We do know that the vaccines work against it, but in people who are not vaccinated, we're concerned that it's going to spread like wildfire because it's 50% more contagious than the regular COVID. And so the same with the Brazilian strain, it's more contagious. And in Brazil, we're seeing it affect young infants and small children who, of course, are not even eligible. There's no vaccine for them approved yet. And so that's why, because we're seeing that in Brazil, there's a concern of, will that also happen in the United States? Because that population isn't covered. We're seeing young children get sicker. We're even seeing more deaths in that population. So another reason to hurry up and get vaccinated so that it will help protect those in our population, like children who aren't and can't be right now.
Wow.
Protect yourself with a vaccine.
There you go.
Dr. Mel, you and Wayne know this has been a super, super busy season for me. I love the work that I do, my 9 to 5. But I worked real hard these last few months, and I'm just wondering, can work kill you?
Well, it turns out that the World Health Organization says, yes, it can. And so it seems like 55 hours is the cutoff. If you're working more than that, it can be a really serious health hazard. It's killed hundreds of thousands, something like 750,000 additional deaths as a result of people working those long hours. And most of the deaths are a result of stroke and heart attack. And, this data was pre-pandemic. We also know that people are working harder during the pandemic. Those people working from home are working on an average of 2.5 hours more a day.
Wow.
So that's another thing going on. And the reason why it appears that work has this adverse effect is 2 reasons. Number one, the psychological stress. We all know that when we work long hours, it can actually trigger inflammation in your body, which affects your heart and your brain and your blood vessels that lead to these strokes and heart attacks. And also, people tend to self-treat by smoking, by drinking alcohol, poor diet, not really paying attention to what they eat, not getting enough exercise. It might throw off their sleep, and all these things worsen the tendency to get strokes and heart attacks. So if you don't have the flexibility to decrease your hours, you want to make sure that you're doing something to de-stress on a daily basis, even if it's a 5-minute breathing exercise in the middle of the day, just to slow your heart rate, get your anxiety down, and relax.
I've started doing desk yoga. Chair yoga.
There you go.
Oh, chair yoga.
Excellent.
Wow.
Chair yoga, very important. They even have chair Tai Chi too. So
wow.
A lot of different options out there.
Okay. I do chair music, chair dancing. Chair dancing.
Whatever works for you.
I do chair dancing, man. Just look, and that takes us to this. I have a friend who had COVID and didn't go to the hospital. They said it wasn't sick enough, but since that they've had 3 pulmonary embolisms. We also had one of our guests on Nurse Bartonelli, who had high blood pressure symptoms after having COVID.
Right.
What are they saying? And I don't think she went to the hospital either. I don't think she was admitted to the hospital. So
She did. Yeah, no, she was not. So, COVID is turned out to really be a disease of the blood vessels, not a disease of only the lungs, like it was billed in the beginning that it was COVID pneumonia. It attacks the blood vessels. Blood vessels are all over our body. It slows down blood flow. It can cause blood clots. It can lead to less blood getting to parts of the body where it needs to get to. And so that's one of the ways in which it's causing long COVID. So your friend who had the pulmonary embolus, and so for those people who, let's break that down, that's blood clots that start off in your legs or some other part of your body, break off and go to your lungs and can cause serious problems, even death. And so what they're seeing now is the people who have long COVID, first they thought, well, it was only people who were sick enough to be in the hospital. But we're actually seeing that even people whose COVID was not severe enough to be hospitalized, they are having complications like the ones that we mentioned, including high blood pressure, never having blood pressure problems before, but afterwards having blood pressure problems for several months and having to be put on blood pressure medicines. So even though it's less common, it's happening in individuals in the bottom line, in individuals who were never hospitalized. So the bottom line, don't get COVID. It's real. It's worse than the flu. And if you can avoid it or help others avoid it by wearing your mask, social distancing, and getting vaccinated, please do so. It's not to be played with.
I'm going off script just a little bit, Wayne. Dr. Mel, are there any top of mind symptoms of PEs that people might look out for really quickly?
Yeah, and unfortunately, they're kind of similar to a lot of the long COVID symptoms, which are dizziness, shortness of breath, chest pain. Typically, though, with a pulmonary embolus, they happen suddenly. Like you're fine 1 minute, and then the next minute you're fatigued, you're dizzy, you're short of breath, and you have a sharp chest pain. So those are things to look for. But if you have any of those symptoms at any point in time after having COVID, you should seek medical attention anyway. Talk to your doctor about them because obviously they're not normal, and you need to be closely monitored to make sure that there isn't something serious going on.
So since we're off script, I'm going further off script, and this is a news flash. We have on our timeline Nurse Bartonelli, and she reports this. Yes, I had hypertension, and it's better with her meds, and she's increased her exercise. So fantastic, Nurse Bartonelli.
And she was a fantastic guest, and thank you so much for weighing in on that and giving us an update.
And to one of our special listeners, she just typed in she had lost a nephew from those very symptoms last Tuesday. So
I'm so sorry to hear that.
Our hearts go out to you, Tracy.
Indeed.
And I won't post it, but everybody, I will post it but he was only 40. So
so sorry to hear that. Again, those are the people that we need to be protecting by our everyday decisions. And, again, our deepest condolences to your family.
Right.
Yes.
Right. So that brings us to the next subject, which is really a subject of what do you call it? Just having too much in this country, where really the vaccine now is pitting American teens versus African grandmothers. And you want to explain that, Dr. Mill?
Yeah, every week we've been talking mainly about COVID in the United States, but there's a whole world out here where other stuff is going on regarding COVID. I mean, we hear a lot about stuff happening in India with how it's decimating India. We hear about the Brazilian variant, like I just talked about. But the reality is, in the grander scheme of things, we're talking about 600,000 or so souls who've been lost to COVID here in the United States. It's 3.3 million people worldwide. And the thing is, the second year of the pandemic that we're entering now looks like for the rest of the world, it might actually be getting worse and not better. Whereas in wealthy countries like in Europe and in North America, we have plenty of vaccine to go around, so much so that we're able to offer it to our teens. In African countries, in some other parts of the world, the vaccination rate is, or actually, they have received less than 1% of the world's COVID vaccine supply. So while our teens are here getting vaccinated, African grandmothers and grandparents aren't, because there's just not enough vaccine to go around. It's so inequitable that the WHO is actually calling for Americans and other and European countries to give up some of our vaccine supplies so that elders in other parts of the world can get vaccinated. Again, it's a first world problem that we have with the anti-vax folks in our society, or those people who just say, oh yeah, I want to wait. We have a luxury to be able to say that, and keeping in mind that seniors in other parts of the world are going uncovered.
Yeah. Luxury was the word I was looking for. Thank you for helping me out with that. And
absolutely.
So we come to this part of the show. It's a very special part of the show. You know what it is, guys?
The weekly debunk. Stopping misinformation in its tracks.
So our debunk today is from Tyrone Twitter Fingers. He says, hey y'all, I got it all figured out. I am waiting on herd immunity, so I don't need to get vaccinated.
Tyrone, I don't know what you're talking about. Is he right, Dr. Mel?
No, Mr. Tyrone is not right. Herd immunity is a real thing, but it's not something that you wait on like a train. You have to be part of the solution, because it's the number of people in our society with immunity, and it has to be 80% or more of the population. So it makes it so that the virus has nowhere to go. And so Mr. Tyrone is mistaken for two reasons. Number one, if you don't get vaccinated, you have to severely curtail your activities. You have to cut down on the stuff that you're doing and where you're going in order to avoid getting infected with the COVID virus. And you're really playing a game of Russian roulette, because you don't know how your body is going to respond. Chances are you'll do okay, but you don't know if you're one of those people who will end up in the hospital. And if you get infected, especially with a variant, you can infect those around you who are vulnerable, like we just talked about: children, people with low immune responses who don't, even after getting vaccinated, don't get a great, huge response. And that can be due to the medications they're on, pre-existing illnesses they have like cancer, or people who are very up in age. So that's the first thing. The second thing is, to reach herd immunity, like I said, 80% people that need to be vaccinated, hopefully including yourself. But by holding out, you're affecting whatever community that you're a part of, your church community, your workplace community, your neighborhood, your family. You are putting them at risk, because you might then become the reservoir of the virus and the producer of the next variant that will affect them, a more serious variant that their vaccination won't necessarily stop.
Right.
So we know that Black people have the lowest vaccination rate in the country of any ethnic group. That means, as we mentioned before, that the virus can get passed around, new variants can pop up in the Black community, and the children of our community will, they're already the most affected from COVID, but they'll potentially be even more affected because they are not yet vaccinated. So no, Mr. Tyrone.
Tyrone sounds very selfish. Don't be
well,
like Tyrone.
he's just misguided.
Okay.
He's just misguided.
Okay.
And so, yeah, but I want to thank you all for bringing us the recap and the debunk. I'm going to say goodbye for now, but I'll see y'all shortly. And we are going to move into our show for tonight. Before we do that, I just want to remind y'all, we're going to be answering questions in about 15, 20 minutes or so. So start typing them into the chat, because it's going to be, first come, first typed in, first answered. So Want to see those questions. And then, of course, tonight we are talking about the parents who are having to make the decision, not just about themselves getting vaccinated, but now they're early teenagers, so age 12 to 15, because the Pfizer vaccine for COVID-19 is now approved in that age group. And actually, in some municipalities around the country, I know DC specifically, there's a law that allows minors age 11 and older to decide what vaccines that they want to get. So for that reason, we have two really special guests. The first is Elena, who is a 14-year-old, going on 15-year-old, who's from the Columbus, Ohio area. She's an athlete as well as a violinist and a musical theater performer. And she is going to tell us her thoughts on herself and her peers getting vaccinated, because like I said, 11-year-olds and older can make that decision for themselves in several places. So welcome, Elena.
Thank you for having me.
Absolutely. And then our next guest, wonderful pediatrician, Dr. Larelle Bradley, who's actually double board certified. So not only is she a pediatrician, she is also a certified holistic and integrative physician. She has a master's of science in cellular and molecular biology too, so she can help us break down and understand the science behind the virus. And she fervently believes that being healthy is not just for the wealthy. So she dedicates her practice to serve, to treat, train, advocate, educate, and address access to healthcare and health disparities, with a focus on the DC, Maryland, and Virginia area. So thank you, Dr. Bradley, for joining us.
Thank you so much for having me, Dr. Clarke, Dr. Mel.
Absolutely. So let's just jump right into it. And Elena, I am going to start with you. So I know that, and I should also say, full disclaimer, Elena is my niece. So that's why I know so much about all her wonderful skills and talents. So what has it been like going to a hybrid school up until I think about March, and then going to school full time after spring break? How has that been in terms of your concerns about potentially bringing the virus home to your family?
Well, as you just said, for my school, we did hybrid, where half of our school goes in and half of our school doesn't. And it was altering days. And for that, bringing the virus back to my parents, it kind of was a shock when I first heard that we were going to be hybrid, because all the schools around me were online. But I was very constantly aware of what I was doing, who I was around, where I was eating, for example, since we had to take our masks off for that. But I had to be very aware, since I do have two high-risk parents and high-risk friends that I'm around sometimes. I'm always vigilant and aware of what I'm doing, since this virus is almost unpredictable about how you can get it and stuff. So I just make sure to be vigilant at all times.
Right. And that has to be very stressful, to have to be vigilant all the time. Did you find it to be something that was causing you anxiety or concern?
I did at one point, especially the beginning of the year, where I was doing hybrid. But once we got to the middle of the year, I had decided, since it was flu season and some of the COVID symptoms are like the flu symptoms, I just didn't really want to mix myself into that. So I decided to go fully online, and we're given the choice to do so. And when I did, I noticed that I did feel a lot less stress on having to protect my family and my parents and also me. Yet the social aspect that I was lacking online really did pay a toll to me mentally. So after that point where I was online, once I got back into the groove of things and went into school, I learned that my mental status was probably a lot better. And my anxiety about that was dying off, since right then we were just introduced into the vaccine and how people that were higher risk were able to get them. So once that came out, I definitely did have a little relief and felt that I could be social and without the fear of bringing that back, bring the COVID back to my parents.
Yeah, no, that makes total sense. And so your parents got vaccinated. Since that pressure, in a sense, was off, what led to you deciding to get vaccinated? And I guess I'm letting the cat out of the bag because you have had your first dose, right?
Yes, I have.
Yeah.
Honestly, I felt like I could contribute and to helping stop this virus that has taken a toll on everybody in one way or another. I felt that was my way that I could contribute, since I'm not a doctor or a nurse or anything like that. But I felt that was a way that I could get involved and help out by making not only myself, but the ones around me a little bit safer.
Great. Well, thanks for sharing that with us. I'm going to go to Dr. Bradley. And I want you, Dr. Bradley, to tell us about the vaccine studies in children 12 to 15-year-olds. What do we need to know first about, does the vaccine work? Does the Pfizer vaccine work in this age group?
So the data does say that the vaccine is safe and effective, which is why it has gone through the whole process of being released to be able to give to the children that are 12 to 15 and help prevent the further spread of the disease, just like what Elena was discussing. And I think that I'm just so proud of her for going in ahead and being so mature and taking advantage of the opportunity and being forward thinking and wise, because there is a lot of risk even to children. I think it's understated. That's a big concern that pediatrician that we have, because people do diminish the effects of having COVID, and they say that children are not affected, but they are.
Yes, absolutely. I mean, there was a whole thing last year that said that kids did not transmit COVID at all, right?
That is not true. They're great carriers. Children are known to be petri dishes, and they have different symptoms than adults do. And so they may be asymptomatic and you do not know it. Even
meaning no symptoms. They have no
yes.
symptoms.
Thank
Yeah.
you for clarifying. Yeah, they can have absolutely no symptoms and spread it to their friends that may be immunocompromised, as well as their parents and grandparents. It's very responsible for children and parents to make that decision to vaccinate, because it is not just protecting yourself, but it is protecting the community, and it is helping these United States get to a place where we can have more ability to socialize and not have our mental health affected so much by the pandemic. So it's a good thing.
Absolutely. Now let's talk about, we talked about the fact that it works in 12 to 15-year-olds. Actually, I think their immune response is just absolutely, wonderful, because their immune systems are so assertive at that age. But let's also
still
talk
learning.
about, what's that?
Children are great because their immune systems are still learning at that age. And so introducing that type of memory has the potential for giving a longer, possibly even depending on what the schedule will be, because we know the vaccine is relatively new. So we want to make sure that the studies will support its use, and children really are able to have better immunized states afterwards. Apologize.
Yeah, no, they mount a more
They've
robust
done a better immune response.
Response, yeah. So let's talk about safety. What are you hearing and understanding about safety from the initial trials, and then how the rollout is going?
What I have read is the safety is very good for the children during this vaccination period of time, and
I think that I've heard that as well. I've definitely heard that as well, and I know that as far as safety goes, we're seeing really good numbers. But then just in the last couple of days, there are some questions about something called myocarditis, which is a real fancy word for inflammation of the heart. So what are you hearing about that?
Yes, there are more reports that are showing just a handful, up to a couple dozen of patients that have had reports and have been diagnosed with myocarditis, which is it's not uncommon among the pediatric population to have myocarditis. It usually is caused by multiple types of viruses, also other inflammatory diseases like lupus or types of arthritis, and even some bacteria. And so we're wondering, and we need to look more into the studies, have more studies to show whether the myocarditis is a real thing or if it still is just what a regular population that's not vaccinated, whether they would get it or not. So not sure that it's related to, correlated with the distribution of the vaccine, administration of the vaccine.
Yeah, no, that makes perfect sense. And, I talk a lot about that vaccine adverse event reporting database, and that the purpose of that database is for any possible event that happens after you get vaccinated, whether it's related or not, to get reported so that scientists at CDC and FDA can see, is there a difference in the baseline rate of these occurrences happening in people who have been vaccinated? And so I know that they've looked at that around pregnancy, for example. Are we seeing more miscarriages? Are we seeing more stillbirths? Are we seeing more bleeding at the time of delivery? And that has not been the case. And so the question is, with the myocarditis, on first blush, at least the investigations that have been done so far, it looks like there is not an increase in how often myocarditis is occurring above the regular rate that it happens in the population. Is that your understanding as well?
It is, and I think I'm thankful for the transparency, but I am glad that we have programs like this because it helps explain the what is done all the time in the scientific world as well as the medical world. We have to report everything as often as we see it, and not just take things as anecdotal response and replies that people have. The VAERS system is very helpful in identifying those things, and that's why I'm glad that it is reported, and the population is getting this information early. So the unfortunate thing is that it will cause people alarm, and I'm very concerned about vaccine hesitancy. The vaccine hesitancy is a major problem, not just for COVID-19, but for all vaccines. We're seeing definitely a decline in our regular immunization schedules because of the pandemic, as well as those that are concerned about side effects of vaccines. So it's important to understand that you're being totally exposed to science in a way we've never been exposed before, and be appreciative of the data. However, you need to run and talk to your pediatrician and those that you trust in your community that have knowledge about the vaccine to understand your risk for that to occur, particularly things like myocarditis. Yes.
Are you hearing questions from parents and teens who you're working with?
I specifically serve a population that is naturally vaccine hesitant, very high special needs children. So I would not go by what my patients would say. I do have a lot of friends. I just wanted to make that disclaimer. I do have a lot of friends that have concerns about it. Lots of doctors' meetings and groups that I attend are also concerned about some of the other side effects that are more or less been reported, and they're anecdotal. There's a difference between anecdotal and there's a different and actual things that we're reporting and looking at the odds ratios and the relative risk of it being in the community. So be careful what you really believe, and be careful with what information you're receiving. Please trust us. People that are professional and go through years and years of school don't do it because we're trying to fool you or make money. We really want to save the world. And this is a big part that you as families and parents and children can take in that aspect of it. This is a real pandemic. I do believe the big difference between why there are some hesitancy is because of the patient populations that are affected, this health disparity. It is significantly more seen more popularly in and African American and Latino people of color populations, including the bad side effects. So we really do need to pay attention to that.
Right. And I want to go back to Elena for a while to ask a question. So, the things that Dr. Bradley is hearing in her practice, I wanted to find out from Elena, what are you hearing among your peers, the kids at school and whatnot? Do they have concerns about the vaccine, or, what's the word on the street?
Most of the peers of mine that I hang out with, they are actually pretty excited and ecstatic to get the vaccine since they're pretty social like me. But I do have other students in my grade that do have different diseases that do affect their immune system. So they are not able to get the vaccine, but still in their mind, they do believe that the vaccine will help and would, if they could, get that vaccine.
Okay. And just to be clear, there are really no diseases that would prevent you from getting the vaccine, but whatever your underlying health conditions, always talk to your physician and make that decision in conjunction with them. But that's really good to know. Are people at your school, do you encounter anybody who, their parents don't want them to get the vaccine, but they want to get the vaccine, or vice versa?
Yes, I have, most on the parents not wanting to or not maybe trusting the vaccine. And sadly, sometimes those beliefs do fall on the children too, so they do express those. But I also overheard one student talking to the nurse, asking her where to get the vaccine, since their parents were not really looking for or searching for any areas for them to get it. But a lot of students in our grade have taken their own responsibility in finding and setting up their own appointments and stuff. So they have kind of made it up, this decision more up to them on if they would get it or not.
Wow, that's really interesting. And then I'm curious, do you ever talk in science class about the virus and or the vaccine?
Yes, we did briefly go over by watching a documentary on how the vaccine not only affected us, but also how the coronavirus affects our bodies and how it spreads and how you can prevent it from spreading to people and different symptoms that you would also get.
Mm-hmm. So it doesn't sound like you touched on the genetic material and that's in the vaccine. So I'm going to go back to Dr. Bradley to break that down for our parents and teens that are listening, to explain how the vaccines work, and then answer that all important question that everybody wants to know: can it affect my fertility? Because I think as parents are making that decision for their kids, they want to make sure that there are no long-term side effects. So first, maybe talk about how the vaccine works. Let's start there.
So in general, vaccines work by teaching our immune system to be prepared when we are presented with a offending virus or microbe. I like to think of it in the Bill Cosby way, where they're just a little germs and they're trying to come into your body. And then your body is like, oh my gosh, we have to attack this thing or we're going to go crazy. And you get these other symptoms, including a fever and a cough and trouble breathing and everything. And so when you get a vaccine, you're actually having a portion of an inactive part of the virus. What we have in the vaccine for Pfizer is the spike protein that is recognized by our bodies, and we are able to mount an immune response. That's like, okay, we got this, and we start building antibodies for when we are going to be exposed, not if we're exposed. I say when because, hello, this thing is smart. This thing is going ahead and mutating, and we need the force to go with it. And we have a body that knows how to fight. And in science, we have learned a beautiful thing in order to be able to fight these viruses, particularly this deadly virus of COVID-19. So the Pfizer vaccine is a messenger RNA vaccine that carries the spike protein, and it is very, it's mounted a great immune response, as we discussed before, and what it does is teaches cells to produce these antibodies that are helpful and protective. Now, people are concerned that it changes DNA. It doesn't do that because it doesn't get to the nucleus, and I apologize if that's too complicated, but it doesn't get into the nucleus.
I call it the section of the cell where our DNA is protected from anything.
Yes.
It doesn't get into that section of the cell.
Exactly. It does not get into that section of the cell, but it's amazing how our body works to do the right thing. And messenger RNA is a vehicle with which that is carried to mount the immune response to our to protect our children and ourselves when we get vaccinated. It's a smart thing, and it does not cause a lot of. Now, people are seeing certain side effects, and you mentioned previously blood clots is one of the things that happens.
Right.
And we
With
know
the
that it's a
Johnson &
disease
Johnson
with the
vaccine.
Johnson & Johnson specifically. The children are not getting Johnson & Johnson. This is different. It's Pfizer. The question about infertility, the studies have been done in larger populations, and in that they did include pregnant women and women that were of pregnancy age that did get pregnant during the study, and women that were trying to get pregnant and they were able to get pregnant. There were no infertility signs in that patient population. The question may be, and I've also want to talk a little bit about the concern about menstrual cycles and what the effect it may have on the menstrual cycle, because that's another kind of, I wonder if, and I'm not going to do it because of this, it's messing up the menstrual cycle. Well, there's a lot to that because the children.
Well, you know what? Before we go into that, I want to make sure that I get the audience questions, and I'm pretty sure somebody in the audience is probably going to ask that. So let's bring back Lila and Wayne, our co-producers, to bring us some questions.
We definitely have some questions. So I'll start, Wayne.
Okay.
First question from Valerie Spalding Parker. I'm curious, how well were the teens at school? Oh, this is for Elena. How well were the teens at school complying with masking and distancing?
So at my school, we have this thing that all the teachers say. It's like a little saying. They say, fix your six. So if we're ever in like a big cluster all together, they'll just say, fix your six, guys, and then we'll all spread out. But if we're being honest, my school has been very well and strict with the mask mandate and how to keep your mask on no matter what. And when we're eating, we even have to eat outside, spread out. And the students, even when there's not any supervision by any teachers or anything, we do usually comply unless we're like getting a drink or something. But we do comply to those rules. And if someone isn't, then some other students will probably go up to them and remind them, pull up your mask. We're still in COVID and there's still a pandemic going on.
I like it. I like that fixture. I like that fixture 6 for social distancing.
Right.
Like I'm gonna start saying that in the grocery store. Fixture 6.
Just don't say it in the liquor store. Picture 6.
Anyway, next question is from Janice Gatson. She says she only got the first shot and started having those issues. I'm believing she's referring to the PE symptoms that we discussed. What do I do if I don't get the second shot?
Okay, so first of all, I would say if you're having those symptoms, those are not typical side effects of the vaccine. So you need to go, I wouldn't assume that they're related to the vaccine at all. I would go be evaluated by a physician to understand why you're having those symptoms. You need a COVID test because it's not unheard of. As a matter of fact, referring back to Nurse Bardinelli, I believe she said that she got her COVID symptoms. She developed COVID right around the time of her first COVID vaccination. So, that's very important to be clear about. And number two, once you know what the problem is, that will immediately determine whether you should get the second COVID shot or not, right? Chances are that it's not due to the vaccine, but I will say talk with your doctor about getting that second COVID shot, depending on what the outcome of your evaluation shows.
Okay.
Next question comes from one of our favorites, Yvonne Smith. What treatments are available for children? What does a very sick child with other chronic illnesses who may not have had the vaccine? We'll figure
so meaning treatments for COVID-19,
right,
if a child gets sick.
Right.
Dr. Bradley, can you take that?
Yes, I can. We do go over when children are positive or even being exposed to someone positive, we do need to track them for different types of symptoms. We do symptomatic treatment. Children will have trouble breathing if they have underlying things like asthma. We would definitely want to control their asthma, just like with adults. You want to control their underlying disease, condition to make sure that they're as healthy as can be during COVID. And also, they should get the vaccine. And another thing I like to do, because I do holistic and integrative medicine, is make sure, I think I heard on one of your shows before, vitamin D. It's a big thing to help us boost our immune system, and it's very important. And those are some things that we want to make sure. Again, partnering with all of the specialists that a child with a chronic illness may have, and getting their opinions and seeing what they feel that a child is able to do in order to get the vaccine is advisable. And so partnering with your physician and having those decisions made as a team is what I would suggest.
Yeah. And I know just as in adults, steroids have a role to play in treatment of COVID-19 if it's severe enough and if it's at the right point in the illness. You don't want to give it too early. You want to give it once the virus has run its course and it's the body's immune system that is, or inflammatory issues that are causing the symptoms. So
I do want to just make a plug, and not too much, about children do get extremely sick with the multi-system inflammatory disorder syndrome that is in children. It is rising right now, actually, because of the people feeling comfortable and not wearing the mask. And children actually are having an increase. Slow increase. We actually have more than 3,000 children that have had the MIS-C and been hospitalized, and we've had a few deaths. So that needs to be something aware of. Families that are exposed or have their children have COVID, they should also just continue to monitor your children, just make sure they're breathing okay, make sure they're feeling okay, they're not having disease symptoms, they're not having any unusual symptoms, because even if they had it, things can happen weeks and weeks and weeks outside of having COVID, and you might not associate it with the disease. So be cautious and conscientious. Don't get COVID, just like Dr. Mel said, but get the vaccine, because ultimately there will be an exposure of some kind.
Great points.
We have a question coming from Cassandra Newby Alexander. When should those who are vaccinated be prepared to get the booster?
Hi, Professor Newby Alexander. So we don't know yet that a booster will be required. There are some signs that suggest that will be the case. Some of the Pfizer, for example, Moderna are studying the need for a booster, and it's looking like they're starting to say, yes, it looks like that will be the case, but how often and when is still yet to be determined, because they're still under review. The other reason why a booster might be likely is, like I said, we're seeing more and more variants, and because people are going unvaccinated for longer and longer, we know that more variants will rise in the population. Every time the virus gets into somebody's body and reproduces millions of other little viruses, there's a chance that a change will happen in the blueprint of the virus that will give it an advantage to either be more contagious or more deadly. And so for those reasons, because we're lagging and getting everybody vaccinated, the chances that those variants will pop up and be harmful raise the need for a booster in the future.
Okay.
Boosters are not unusual.
Right. Right. No,
Yeah.
that's fine, doctor. I have a question from Angela Mays. We've been hearing that Bill Maher was fully vaccinated, but still caught COVID and had to shut down his show. Can people expect to still catch the virus even after being fully vaccinated?
Yes. So basically, remember those percentages that you heard that it was 94, the Pfizer and Moderna were 94% effective. And I think there was an update that real world, after all the data of 100 million people had been looked at, that in the real world it was about 90% effective. So that means that 10% of the time, those people who got the Pfizer or Moderna could still get a coronavirus infection. Does that mean that there were symptoms? No. And there's still, though, the chance that a very rare people will get symptoms. But for the most part, people who get an infection post-vaccination, it's milder than it would have been had they not been vaccinated, or they have no symptoms at all. I believe Bill Maher didn't have any symptoms, but the reason he shut the show down was so that he wouldn't spread it to those people who were unvaccinated on his set. So, the benefit of vaccination is it gives you a layer of protection. It's like a mask. It is not 100% effective, but it's better that you have it than you don't.
Great.
Okay. We have quite a few questions concerning the same thing, but I would like to take producer's privilege at the moment, and I'm very, very calm to say, let's be respectful in our comments. If this show is not for you, please find another show to go to. Was I okay, Lila? Was that cool? All right,
You
thank
were
you, Lila.
much nicer than me. Yes.
Okay. All right. That means your disrespectful self, sir. Okay, thank you. All right. What are this goes, our next question is Estelle Lloyd. And what are the major symptoms young folks are having? And I don't know if she means from the vaccine or from COVID.
Well, why don't you take that, Dr. Bradley, and talk and speak to both. First COVID and then the vaccine.
So for COVID, children, again, usually are asymptomatic. We were seeing early on when we were studying children that they were mostly having abdominal pain and not vomiting and diarrhea. And later on, and then they would just continue on and recover pretty well, staying hydrated with supportive types of care, making sure that they can have the fever controlled, making sure that they're okay with their breathing. Those are the main symptoms for after COVID and infection. Again, don't forget about the multisystem infection, inflammatory syndrome, because it is very serious. And after the vaccine, children are experiencing same symptoms as adults, where they are having localized pain, where they have their injection, and sometimes they'll have the fever and headache and flu-like symptoms. And usually that lasts about 24 to 48 hours and they recover. And I like to tell people, make sure you're prepared with lots of water and Tylenol, as they say, to help with fever control. And you take good care of yourself. Make sure your nutrition is up, eat clean, vitamin D, as well as other immune supportive types of supplements.
I have a
All
question for Elena. What are you most looking forward to when we get to herd immunity and get back to school?
It would probably be able to give my friends a great big hug, because I'm a hugger. I love like affection, and I haven't been able to do that. I've been able to do like air hugs and air high fives, but just to give them like how I show my love and caring back, it just sounds amazing. I'm so excited.
Nice.
That's
And
cool.
and how do you feel after your first vaccine? Because you've had one of the two.
Besides a sore arm, I felt great. It lasted about a day or two, but besides that, and like the anxiety from looking at the needle, I was fine.
Never look at the needle.
Never look at the needle. Never look at it.
Right. So we have a couple of questions. I'm going to combine them. One comes from Richard Goodjoin. He's on YouTube. Dr. Mel, I've heard a big concern about future fertility. And Yvonne Smith comes back and says, surprising that people are not worried about the ED that comes with the long haul COVID for young people, for everybody. And I think we
talked about the ED
last
Yeah.
week. So,
Yeah. So ED stands for erectile dysfunction, when blood is not flowing to your penis in order to get an erection. And we see that they're seeing that, urologists are seeing that as one of the long haul symptoms of COVID-19. So the first question, though, I think, Dr. Bradley, if you could you were about to talk about periods, menstrual cycles, and the vaccine. So if you could also, you already addressed, I think, the fertility issue. And
Yes,
thank you, Richard Goodjoin, for that question.
Yes. So the menstrual cycle is basically the uterus going ahead and shedding a lining if it's not having a sperm there to fertilize and people get pregnant. So it can be thicker if there are things like stressors or things that cause inflammation. So that's one thing to consider. So that can make you have a really heavy period, and sometimes other types of hormonal dysfunction can help have you get actually skip periods or irregular periods. That's just baseline. Anecdotally, there are reports of women having that. They haven't done the study because they didn't really ask the question. In all honesty, they are looking into it now, and I say scientists are looking into that concern now. They actually did. There was a study about rubella vaccine that did show that that was something of a concern. So it wouldn't be the first vaccine that did have increased bleeding or menstrual cycle changes.
But the thing is, they're temporary, even with the
Exactly.
anecdotes. Right.
And
it's just a one-time thing.
It's right. When to worry is if it continues. It's not uncommon after that first dose, and even within the second dose, because you probably will have at least 2 cycles between those 2 doses. But if you're continuing to have that, then you need to see your gynecologist or your family practitioner or your pediatrician for children to make sure that there's nothing else going on, because it has not been associated with COVID-19 vaccine.
Right. And just like, just to underscore that there are hundreds of reasons why women's periods change. And in a population of 300 million people who've received the vaccine, there are about to be some women who have irregularities in their period just because. So all very important to keep in mind. Well, gosh, I can't believe that we are at the top of the hour. We have had a wonderful discussion. You guys have been just on point. Thank you so much for sharing your experiences, Elena, and sharing your wisdom, Dr. Bradley. We've learned so much. Again, we as a first world country, wealthy nation, we have this luxury of being able to offer vaccines to our teenagers now, 12 and above, the Pfizer vaccine. So, For you parents out there, I hope this episode has helped to set the record straight on some concerns that you might have, answer some of the questions that you might have, anything that you haven't heard dealt with, please talk to your pediatrician about. And, because the more people that are vaccinated, the better for everybody as a whole. So I want to thank you for joining in tonight. I want to thank everybody that put questions in the chat. I will be back here next week, same time, 9 o'clock East, 6 p.m. Pacific time. And if I don't see you between now and then, remember, be wise, be well, and be health empowered. Thanks again to my guests, and have a great night, everybody.